Hi there, Sasha's here from Eternal Beauty Med Spa. I'd like to talk to you about Tox. I think the best way to talk about Tox is to demonstrate it. What I'm going to do is inject half of my face and not inject the other half of my face, and then show you what the differences are and how things are looking in about a week or so. I'm going to inject the right side of my face with Jeuveau. It is one of the newest toxes that's available on the market today. And then the other side, I'm going to inject with a different toxin a week or so after Jeuveau has kicked in, settled in. And then it will be interesting for me and everyone else to see what really the longevity is of the two toxins if we're comparing them side to side, so that we're comparing apples to apples on the same face, and also exactly how they affect the muscle movement. And so we're trying to relax the muscles. My total typical tox dose for my face is about 70 units. That's because I don't inject just the upper face. I also go to the lower face, and I'll kind of talk about each area as I mark this out. So I'm going to start by marking out where exactly I'm going to be injecting. So I like to use this tool as a measuring tool for consistency. And I typically stay about 1.5 centimeters away from the top of my brow. So that will be one injection point. There's going to be another injection point about right there, and one in the middle. And I will inject the middle so that we'll see what it kind of looks like. And you can see me animating. The biggest wrinkle I have on my forehead is this one, so that injection point should take care of it. And then you are also seeing the wrinkles happening here, and that's because the frontalis muscle, the forehead muscle, is moving down, while this bottom half of it is moving up. So we need to relax that too. So we're gonna put a point here and another point here. As we move down, we're going to look at the mid-brow region. If I scowl, you're seeing this and this form. So these we call the 11s. The best way to treat the 11s is to make this muscle stop moving or relax it. You can see that it originates about here, and then there's also movement here, so we need to relax that as well. So that's another injection point. When I make this face, this part of the muscle kind of moves down and causes this wrinkle. So we're going to relax it by going right between the brows. I'm going to make another face, which most of us make, and it's this face that something smells. It's this face. You can see that this wrinkle is also forming. In my opinion, this is the ugliest wrinkle there is, because it's just in such an odd place. But many people I see in the clinic have this wrinkle, and it hasn't been addressed before. So we're going to inject here as well. And then if you look closely, when I make a scowl or a smelly face, it's this. You're seeing all these wrinkles. Not very attractive. So we're also going to quiet this muscle, that's the nasalis, by injecting right here. If you look closely, you're also seeing wrinkles at the top of your nose. You can follow along and make all these faces and look on yourself where you have wrinkles, so that when you come see me, or if you're thinking about tox injections, you kind of know already about what you are going to need. So I'll make another injection right at the top of the nose to relax this muscle. This is like a saddle over the nose. So we're going to inject here. As we move towards the side, let's look at this muscle. This is a circular muscle. It's a sphincter muscle, right? So it does this when it's constricting. The best way to relax wrinkles here is to make not just smile. So these are the smile lines, but you can see they're more about here. But if I squint, you're going to see wrinkles appear above here. I'm going to show you. Yep, you see those? The best way to relax those is to start at the very tail of the brow and march along. There's a bony part. You can even feel it yourself if you put your finger here. This is the orbit. The orbit houses the eye. So we don't want to be inside the orbit. We want to be just on the outside of the orbit. And we can make 4 points here. And these 4 points are going to be 2-unit injections, and they are going to relax all of this. As a nice side effect, it opens the aperture of the eye, kind of raising the tail of the brow a little bit and opening the eye all the way this way. We're going to continue working down the face. This lower part also is a place where we do injections. The reason why we do them is because we want to relax a muscle that is about here. It's a triangular muscle, and this muscle is connected to the round muscle of the mouth. The round muscle of the mouth is also a sphincter because we do this. So it completely encloses on itself like the old shutter in the cameras. When this muscle gets activated and pulled down, we're making this I don't know face. If we do a tiny bit of Tox right there, we're going to prevent the corners from being pulled. Why do we care about that? Well, the reason why this is important is because as we age and get closer to our 40s and 50s and up from there, is if we do this face, if we make this expression, we're constantly pulling the bottom down. And then over time, what we see is a resting frown. Even though someone is not making that expression, they're not sad. Visually, they look like that. Eventually, what you also see is a development of these lines. These are called the marionette lines, and those are kind of difficult to treat. I mean, we can put filler here, but it is much better to prevent from this expression happening than to treat, because then it's just filler that has to go here to fill up that space to give support to the corners of the mouth. So we're going to treat here. When we look at the lower face, we also look at the chin area. As we age, our chin starts to kind of ride up, giving our lower jaw more of a squared off look. That's more of a masculine look. Most women are not wanting that look. In our youth, we had more of a pointy chin because this muscle wasn't activated so much. And I'm going to show you the kind of an activation I'm talking about. It usually happens when we make the frown face, we activate the chin at the same time, and it looks like this. Now that the chin has moved up, this is looking very squared off, and that's not attractive. It's better to have your chin relaxed. Also, just visually, some people are bothered by the dimpling here in the chin. I can show it to you again. So we're going to inject this part of the chin as well, and that's going to prevent me making that face. Now, besides the squared off jaw, some people also have a crease right here. That crease also, with time, really can be only remedied with filler. So in order to prevent that, we can relax the chin, and then you'll prevent needing filler as years go by. Another part on the lower face I want to talk about is the area around the mouth. And these are called smoker's lines, but you don't have to be a smoker to get those lines. You just living normal life, talking, drinking out of a straw, pursing your lips, kissing perhaps, causes this from happening. These little lines start to appear. Again, this happens typically as women age into their 50s and closer to 60s, but this is a very low dose and preventable treatment with Tox that we can do to make the movement less drastic. That doesn't mean we're not going to be able to do that. It just means that it won't be as drastic. So we're going to inject a tiny amount of Tox here and here. Then you will see in about a week or so, when I make all my expressions, how different it's going to look when you look side to side. So remember, we're injecting my right side. So the next time we inject, we're going to be injecting this side in about a week or so. The Tox I'm going to use is called Jeuveau. This Tox kicks in, and I see results on myself in really about 3 to 4 days. It starts to kick in, and I'm seeing a noticeable difference. By about day 7 on me, it is fully kicked in. Last time I had to inject myself with Tox was 6 months ago. It was in August. And you wonder, how can you go 6 months injecting Tox? I can, because my levels of collagen in my skin are so high that even though I'm making expressions, the lines are not forming. The sorts of rejuvenating procedures I'm talking about is I do a series of 3 of microneedling with PRP injections every year. I also do a series of 3 of the Tixel every year. I also have injected a biostimulator called Sculptra, and that helps with skin tightening, tone and texture of the skin because it's tighter. And it also stimulates collagen. So it's an injectable product that stimulates collagen and collagen production on the inside. Sculptra gets injected all throughout here. And then when I do microneedling, of course we do the whole face and the neck and the décolleté, but my collagen levels are really pretty high here. I would say similar to someone who's in their 20s, because as you know, 20-year-olds make all these expressions and they're very expressive, and especially children, but they don't have wrinkles that last because their levels of collagen are so high. A good analogy for that would be if you take a rubber band and it's a new rubber band, you can stretch the rubber band and the rubber band stays intact. If you keep the rubber band in a drawer for a year or 2 and next time you go to use it, it snaps. A similar analogy to what happens in the skin, right? I can afford to have movement and still not form wrinkles. However, I do need to inject myself every 6 months as opposed to every 3. So that's a big benefit. I mean, that's a big savings. And then essentially you're investing into the collagen levels of your face, not just the parts that get injected with Tox. I mean, all of your face, the lower face, and the neck and the area of the décolleté. So I'm going to inject, and stay tuned. In about a week, we'll do the second half. And then a week from then, we're going to see if there's a difference between what we inject over here, which is Jeuveau by Evolus, or a different product, a different toxin, which I haven't decided on which one we're gonna do. Maybe we'll do Dysport, maybe we'll do Botox, we'll see.